Hello friends, I'm Dr. Rajat Gupta, your pain physician. I've come here today to talk about a very important topic, plantar fasciitis, because this is the most common cause of heel and foot pain in adults. It is especially seen because of the strain to the plantar fascia, especially in people who are runners, who stand for a long time, jumpers, dancers. Now, plantar fascia is a thick band of tissue that extends from the heels all the way to the toes. Its function is to support the toes to bear the weight when the heel rises during walking. The most common symptom which a patient presents is pain in the heel or the sole, especially when they try to get up out of the bed, try to walk, they are unable to walk. Or if they are sitting for a long time, they try to stand up and walk, they are unable to walk, they feel a lot of pain. People who stand for a long time start feeling pain in the heel and the foot, again is one of the symptoms of plantar fasciitis. When we talk about risk factors, obesity, jumpers, dancers, people in profession which has long standing hours like traffic policemen, doctors, professionals, workers, they tend to suffer from these problems. If I talk about diagnosis, it is very simple. History and medical examination is enough to make a diagnosis of plantar fasciitis. You don't need imaging such as X-rays or MRIs to confirm the diagnosis. But at times when you suspect a stress fracture of the heel or the metatarsals that can lead to these pains, then you need to evaluate or rule out the red flag. Coming on to treatment. Rest and avoidance of triggers is one of the most important treatment modalities for patients to relieve such pains. Hot packs are very important. If you are suffering from these problems, then you tend to use silicone shoe inserts, which reduces the pressure on the heel. You can also use cushion-soled shoes and gel heel pads, which tends to be very useful and beneficial in relieving these pains. A very important point is that you should avoid walking barefoot. Pain medications can be used such as non-steroidal anti-inflammatory drugs such as ibuprofen or naproxen. But you have to be very careful with the use of these drugs because they have serious side effects. You can also use topical non-steroidal anti-inflammatory gels or ointments that can be applied at the area of the pain. Stretching exercises such as calf plantar fascia stretch is very beneficial. Foot ankle circles, toe curls and toe towel curls. These are different foot exercises which are very useful in patients with plantar fasciitis. There have been use of injections or interventions to relieve these pain, which includes use of steroids or prolotherapy or platelet-rich plasma, which is generally being done by the pain physicians under image guidance, ultrasound or X-rays. Other treatment options can be use of tapes, splint support at night, and casting. That has also seen good effects. People have also tried using shock wave therapy, but the evidence for the use of such therapies is not very good. Surgery, of course, is the last modality of option, which should only be opted for if the other modalities have failed in relieving pain. So you must try conservative therapies for 6 to 12 months, and if the pain persists, then surgical option should always be considered. If you like the video, please like the channel, subscribe to it and share the video. If you have any queries regarding this, do write to me in comments. Thanks for watching.